Hello and welcome to Seasoned and Smart. My name is Rachel Pennellatore and I'm a Quality Assurance Specialist with Greater Lynn Senior Services. Our topic this month is the Program for All-Inclusive Care for the Elderly, also known as the PACE program. Joining me today is Michelle Hagerty, who's the Marketing and Outreach Coordinator for the program. Welcome, Michelle. Thank you for being here.
Thank you. Thank you for having me.
So I'd like to start out and ask you to go ahead and tell me about what the PACE program is.
PACE stands for Program of All-Inclusive Care for the Elderly. It's a Medicare program for older adults and people 55 or over living with disabilities. The program provides community-based services to people who otherwise need nursing home level of care. PACE was created as a way to provide seniors, their families, caregivers, and professional healthcare providers the flexibility to meet seniors' healthcare needs and to help them continue living in the community.
So how does PACE coordinate all of these services?
An interdisciplinary team of professionals will give seniors the coordinated care they need. These professionals are also experts in working with older adults. They will work with seniors and their families, if it's appropriate, to develop their most effective plan of care. PACE provides all of the care and services covered by Medicare and Medicaid, as authorized by the interdisciplinary team, as well as additional medically necessary care and services not covered by Medicare and Medicaid. PACE provides coverage for prescription drugs, doctor care, transportation, home care, checkups, hospital visits, and even nursing home stays whenever necessary.
What else should a person know, or does a person need to know about the PACE program?
It's important to know that emergency services are always available 24/7. Medical specialty services are encouraged. All therapies are included. That would be physical therapy, occupational therapy, speech therapy, along with recreational activities. Our adult daycare is available at our sites, meals both at home or at our site, dentistry, including dentures, audiology, including hearing aids, podiatry, including orthotics or special shoes, optometry, including eyeglasses, acupuncture, labs, x-rays, and if English is not a first language, interpretive services, not only at our adult day health site, but to appointments in the community. Nutritional counseling, social work counseling, those are just a few of the services we offer here.
That's quite a comprehensive list of services. So in wrapping up, who's eligible to join the PACE program?
Eligibility, you need to meet certain criteria. First and foremost, you must be 55 or older. Live within our service area. That is anywhere from Rockport to Saugus. You need to need services, meaning that you need nursing home level of care. That would be explained by 2 activities of daily living, such as bathing, eating, or dressing. When you're starting to need assistance in these areas, along with a nursing need, such as medication management, diabetes management, blood pressure management, or other types of chronic diseases, that's the time to start investigating about our program. The last eligibility, though, is perhaps the most important. A senior needs to be able to continue living in their home safely with our services. So I often encourage them to think about a program like this sooner rather than later, so that we can get to know them, they can get to know us, and as they age, we can add services as necessary.
And so we at GLIS are very familiar with the PACE program, but for those who may be less familiar or hearing about it for the first time, how does somebody get more information, or where can they go to get more information about the PACE program?
They can simply call our toll-free line, and if it's a different, we'll use the language line if necessary. I myself speak Spanish, but just call and start a conversation. I heard about PACE, I'd like to know a little bit more about it, and little by little we'll work through the process with them.
And I know later on in the show we're going to be talking to one of your physicians who works here at the site, as well as a caregiver for one of your clients. But I was wondering if there's any final thoughts you had or anything else you wanted to mention about how great the PACE program is.
I think one of the things that I'm most proud of is our doctors. Our doctors have the ability to spend longer time talking with a participant and really knowing them as a whole, not just them, but the family dynamics. They follow them here at the Adult Day Health site. If they were to be admitted into the hospital, we're notified. Our doctor rounds at the hospital and oversees their care. That would be the same situation if they were in short-term rehab or at their home. We follow them, we care for them no matter where they are, as long as they stay within our contracted providers.
Well, the relationships and the continuity certainly sound like great features of the program, so thank you for taking the time to speak with us this month.
Thank you.
I'm Rachel Pennellatore, and I'm here with Dr. Joanna Duby, a physician from the Elder Service Plan of the North Shore, headquartered in Lynn, Mass., a nonprofit that administers the PACE program on the North Shore of Massachusetts. They provide health and home care services to nearly 8,000 frail elders since their founding in 1995. Although their clients are elderly, the impact of their services is felt every day by the clients and family members who time and time again state that they don't know what they would do without PACE. Welcome, Dr. Duby. Thank you for being here.
Thank you.
So could you start by telling me a little bit about yourself and how long you've been in practice?
I've been in practice about 16 years. I'm originally from Montreal, went to McGill and trained at the University of Toronto, and I live in the area with my husband, 3 children, and a menagerie of animals.
That's nice. And what is your specialty?
I'm an internal medicine physician, and I have a specialty in geriatrics.
So can you explain for our viewers a little bit what geriatrics means and what a geriatrician does?
Geriatrics is a study of the elderly, and people with a specialty in geriatrics have at least 2 years of training dealing with the elderly. So we get training looking at the elderly in the hospital, in the home, in nursing homes, and we focus on problems specific to the elderly.
So what inspired you to become a geriatrician?
I never had grandparents, and in medical school I was quite worried that I would not like the elderly, and I was quite afraid of them. So I did a rotation in geriatrics, and what I quite liked about the rotation was the teamwork. The fact that the doctor wasn't alone, you had a support of nurses, social workers, and you worked as a team. And your goal was to make people's lives better, and I thought that was a very realistic goal.
It's a great goal. Why should an older adult seek out a geriatrician?
I think a geriatrician has the training of problems specific to the elderly. They'll have the time to look into things like memory problems, falls, problems with urinary incontinence. They'll have the ability to handle patients with multiple chronic illnesses.
So it sounds like there's a little bit more training. So for people that are a little bit more reluctant to transition from a primary care physician to a geriatrician, can you talk about what some of the benefits would be of a PACE geriatrician?
Well, the benefit of PACE is you don't only get a doctor, you get a whole team and you get a whole slew of services. So when you join PACE, you have your primary care doctor and nurse practitioner, but you also have a nurse that's assigned to you. You have your own social worker. There's a day program where you can come and spend time with other elders, with other people that might have interests that you have. There are activities there. In addition to that, we do home visits when someone is too ill to come in. When you're in the hospital, we follow you. If you end up in a rehab or, unfortunately, in long-term care, we continue to follow you.
So it sounds like there's a lot of wraparound supports and things that go hand in hand with the clinical care that you provide.
Yes.
So I know you have a participant that recently celebrated her 100th birthday under your care. So could you tell me a little bit about her and her experience?
Lenora moved up here several years ago. She was in another state having some problems, and her granddaughter moved her up here into a local assisted living facility. She was doing well there, but she had some chronic illnesses that would crop up from time to time. She would have sometimes behaviors that changed. So we were able to avoid sending her to hospital because we could catch these things earlier. Her granddaughter would call, say something's not quite right. We'd go and assess Lenora if she wasn't well enough to come in, and we often could nip things in the buds and keep her at home, or worst comes to worst, sometimes for a short stay in a rehab. As the years went on, Lenora became more frail and she did need long-term care, but even in the long-term care, if Jill, her granddaughter, notices a change in behavior, if the staff notice a change in behavior, we're called and we can treat things before they get out of hand or before Lenora would need to go to a hospital. So we've managed to keep her where she is and quite stable for a long time.
Well, it sounds like she's very happy. And is there anything else you'd like to add about your experience administering the care here for PACE?
I think it's at PACE what's special is that you do have a whole team, and I don't think doctors anywhere else in the community can have the time that I have here to be able to spend with a patient, to get to know them, to really know what's going on, and to work on their problems. In a community and when you have your own private practice, you're too busy. Here I have more time and I have a lot of support, so I think the patients here get much better care.
It sounds great. Thank you for being here.
Thank you.
So today in healthcare in general, and especially for seniors on fixed incomes, I know cost is a big concern when deciding what programs and services people can afford. So I was wondering if you could tell us a little bit about the costs associated with the PACE program.
That's a very good question. There are two ways that you can fund the program. One is privately. That would be when a person has a large amount of assets and spending down would take a while. They could look at this program and see cost effectively that it would be a wiser choice than being in a nursing home. Most seniors want to age at home, and studies do show that they age better and longer in their own home. Nursing homes these days charge anywhere from $12,000 to $15,000 a month. The PACE program is a fraction of that cost, and yet it's all inclusive. Whether you come into this program with Medicare and Medicaid, which is the traditional way, or you pay privately, there is never a copay, an out-of-pocket, a monthly premium, or a bill submitted to a participant. The PACE program oversees all of their care and pays all of the bills. Once you're deemed appropriate for this program, everything is included.
So you mentioned that all of this care, of course, is included and coordinated by an interdisciplinary team. So can you also explain for those at home what an interdisciplinary team is, who's that made up of, and sort of what kinds of things that they do for each client?
Absolutely. Another great question. The interdisciplinary team is each site has a dedicated team. It's always comprised of a site coordinator, medical doctor, 9 out of 10 a geriatrician, nurse practitioner, nurses, personal care attendants, activities folks and coordinators, social workers, and the therapists, as I mentioned before, speech, occupational therapy, physical therapy, they're all right here and available to our participants each and every day, including a medical secretary, a transportation coordinator. Everyone has an integral role in caring for our seniors. Something you might not know, each and every morning, our team sits around together at a table, and they're discussing first what emergencies, if any, happened last night. What does each person in the team need to do for that senior to support them and care for them? After that, the conversation rolls to what are we expecting today? Do we have a specialist in? Is the acupuncture clinic coming in? Is the podiatrist coming in? Who's on the list? A lot of times when listening to a name, they might say, oh, Mrs. So-and-so's coming in? That's great. I have a new piece of adaptive equipment for her that I'd like to fit her for it. So they'll keep in the back of that mind that that particular participant is coming in and they want to touch base with them as well. Everyone is equal at that table. It is important for everyone to share their observations so that we can care together for that senior. Also too, if labs come back or a report from a specialist comes back, everyone is hearing and listening to that result so that everyone is taking a piece from how does that relate to my work with that person. Social worker hears that a participant is at the hospital. She might think to herself, I better call the daughter and let her know. I had one social worker say, I better go by the house and feed the cat. The details go down to that point because we know these seniors so well. That communication is key.
It sounds like everybody having that sort of specialized role and individual expertise really contributes a lot to the overall experience for the participants.
It does. It makes them feel that they're not alone, that they have a whole team caring for them, and they become family, both the participants and the staff.
Is there a typical PACE client?
Well, there really isn't a typical PACE client. Most people might think that an 80-year-old, 90-year-old would be a typical client, but where we start at 55 or over, it can be anywhere in between 55 to Lenora, who's 100. A younger person, a 55, think of a 55-year-old that may have been living with a long-term disability, or perhaps have behavioral or mental health issues. We're able to help with that. We have a robust mental health behavioral department that is able to work not only on an individual basis, but oftentimes in a group basis, which is we found to be very beneficial to have support from others in the program, that the participants enjoy having a group setting for support groups. Also, the one-on-one, we work with a lot of different medications, a lot of different ways of dispensing that medication to help seniors and younger folks, 55 or over, be independent, to attain their independence and maintain it.
So with all of these services, what would you recommend to someone who might still be hesitant to call or may have a friend or family member who might be a little bit reluctant to accept services?
I hear that often from caregivers. My mom would love this program. I mean, this program would be great for my mom, or it would be great for my grandparent, but I don't think he'll come. A lot of that is about becoming comfortable with the concept. A lot of seniors don't want to give up their primary care physician, even though they only visit them once or twice a year. Here, they can come in, meet the staff, have lunch with us, spend a little time, see if it feels right, meet our doctor. Does it feel good? Can you picture yourself coming here? Slowly easing them in. But our enrollment staff is very, very seasoned in that reluctance, and we take slow steps to help a senior check out the program, think it through, and hopefully at the end embrace this change.
Well, I hope it gets a lot more people to call and check it out.
I hope so too.
I'm here with Jill Ammerman, who is a caregiver for Lenora Green, one of the PACE clients who recently celebrated her 100th birthday while under the care of the program. So I'd like to welcome you for being here. Thank you.
Thank you for having me.
So can you start just by telling me a little bit about Lenora, your grandmother, and how her health presented itself prior to joining the PACE program?
Yeah, about 2 years before I moved her up here, her health was going down significantly. Her biggest issue was that she kept getting urinary tract infections, ending up in the hospital, then in rehab, home for about 2 weeks, and then we'd start the cycle again. And it was taking a huge toll on her health in general, and it was not allowing her to have a positive quality of life.
So how did you find out about the PACE program?
I found out about it through a friend who had also been going through this with her parent, actually.
So what was the experience like to get her into the program?
Oh, I found the experience to get her in was very easy. She qualified for it. Everybody was very accommodating as far as how they helped me get the records up from Florida, helped get her up, and helped get her settled. It was basically a non-event.
So what services does she have under the PACE program now?
Right now she's living in a nursing home. So it's more of a almost consulting services. They check in with the doctors here, the nurses, the psychologists. Everyone's kind of, it's a monitoring service now mostly.
And how would you say that all of this monitoring and coordination has helped your grandmother?
Well, number one, she lived to be 100 years old. The quality of life she has is excellent. She's still very mobile. She gets around by herself. She has not been in the hospital for 2 years now. And she seems happy, and she's very happy. She's told me she wants to live to be 105.
That's great. And you said she hasn't been in the hospital in a few years. So what was it like for her being in and out of the hospital in Florida versus the medical care she receives here?
The thing I like the most about PACE is they really take the individual patient into consideration and do what's necessary for the patient. One of the issues that I had in Florida was that she needed more time in rehab than she was getting. And the thing that impressed me beyond belief was that she only was in the hospital, by the way, twice here versus basically 6 times a year in Florida. When she was in rehab, there was a family meeting, and it came up that her 10 days was about up. And somebody from PACE looked at the people at the rehab center and said, this is PACE. This is a PACE patient. If she needs more time in rehab, that's what she will have. By doing that, it enabled her to get better, not just have a Band-Aid put on it. And so that when she went back to, at that time, assisted living, she could stay healthy. The other thing was that at the assisted living level, they gave her other assistance, like a visiting aide, for a few hours a day so they could check in on her. So the whole premise of this program is to keep people healthy, productive, and happy versus just taking care of them when they're sick. They're almost trying to help you not get sick, which is great because then you have a higher quality of life.
Yeah, definitely. So when she's moving from the assisted living into the nursing facility, how did PACE help with that transition?
Mostly they helped me and the rest of the family because that's a really hard decision to have to make. In addition, I had promised a friend of hers back in Florida I would never put her in a nursing home. So the whole decision to do it made it that much more emotional. And the social workers worked with us and just helped us think it through and become very comfortable with the decision. And once you're comfortable with the decision, you can support it, and then you can help your family member feel comfortable about it. And it was the right decision. Since she's been in a nursing home, she has not had to go in the hospital once because they're able to catch the urinary tract infections. And we put her in the nursing home when about 1.5 years ago, so when she's about 98.5. We probably did it almost at the right time because shortly after she went in, her mental capacity started declining some. So to have her in a place, get used to it, and learn how to function in it, and then, so now she's functioning totally still, but with diminished mental capacity. So it's all worked very well. And the good news is that the people at PACE saw this all happening, where I think as a family member you don't want to see certain things. Mm-hmm. So they knew when it was time, but it was a very loving way. It wasn't forced on us. The decision was ours. We could have sent her back to assisted living, but we had some very intelligent conversations, and it made a very difficult decision very easy to make, actually.
So you had the luxury of having the ability to have the staff and your family have the conversation about these difficult choices and making the move to a nursing facility. So what would you say to someone, either someone who's elderly themselves or another caregiver like yourself, to someone who might be a little hesitant about the service or have questions about the program itself?
I don't think there is any reason that anybody should be concerned about this program. I have never felt like they have forced anything on us. They have acted as extremely good advisors and advocates. And I think when you get used to the fact that they're being such a good advocate, you trust them as an advisor. You know, another really good thing about the PACE program is that both my grandmother and I have had a friend, and a very knowledgeable friend. So that PACE has always been that extra person looking out for my grandmother whenever issues have come up, or even when there aren't issues. I always have felt like the places that she's been in have had to answer almost to a higher authority. And at times where I didn't feel like I could push a subject, because as the family member you don't want to be looked at as kind of the nuisance, I had my friends at PACE who would push it, and they could deal with it at a much more professional level than I knew how to deal with, because they knew all the legal ramifications, they knew what she was entitled to, and that has just contributed to a very, very high level of care.
Yes, and thank you. It sounds like you've had a great experience here with your grandmother, and I want to thank you for sharing your story and your grandmother's with us today.
Thank you. Thank you.
Welcome back. That was a lot of great information and a great story. I'd like to just ask Michelle to remind everybody at home where we can get more information if we're interested.
Again, you can always call our toll-free number. You could also check out the website PACE, P-A-C-E, the number 4, and YOU.org. That's a great place to also get some more information. I just wanted to remind you that our toll-free line is answered anytime from 8 to 4 from Monday through Friday. You can feel free to leave a message. We will get back to you on times beyond that. And I'm available at any time to provide a tour, whether it's a family or prospective participant, caregiver or professional who wants to learn more about PACE.
That sounds wonderful, and thank you again for being here today.
Thank you for having me.